Hello, everyone. Welcome back. We are going to dive now into exercise principles. So, no conversation on exercise principles can begin without looking at the general adaptation syndrome and how it pertains to exercise. Hopefully, you remember covering the general adaptation syndrome in our module on stress. And this syndrome explains how all biological creatures respond to stressors in this non-specific way. So we're going along at homeostasis, this normal level of arousal, and we experience a stressor. This puts us into the alarm phase. Our physiology experiences this event as stressful. Then over time, if our body adapts to it, if the stress is not so large, so big that it exceeds our current capacity, we actually enter the resistance phase. We respond to develop new capacities to withstand this stress, both from a physiological and a psychological standpoint. Lastly, if a stressor is too great, too massive, too long, or our resources are limited to respond to it, we may enter the exhaustion phase where we can no longer mobilize a response to stress, and we may develop mental health issues, chronic health issues, or this may lead to early death. So let's look at how the general adaptation syndrome applies to exercise. Exercise is a stress on the body. It is a physical stress on the body. It taxes our musculoskeletal system, our cardiorespiratory system, our nervous system. So whether we're, running, picking up the pace and taxing our heart, our blood vessels, our lungs, or we're lifting heavy load and taxing our muscles and our skeletal system, exercise is a stressor. So initially we have this alarm phase where you first start exercising, things feel painful, things feel hard. The exercise exceeds your capacity to respond to it. And this is one of the principles of exercise, that it has to continually exceed your current capacities. So in order for you to progress. So the exercise exceeds your current fitness level and you experience some initial deficit. You have muscle tissue breakdown from resistance training. You're out of breath, you're sore, you cramp, right? You have an insufficient ability to deliver the amount of oxygen you need to your working tissues. And so you don't go as fast or as hard or as long as you'd like to. Then over time, as your body continues to adapt to the stress that you're placing upon it, you enter a resistance phase, or your body starts to respond by developing thicker and denser muscle tissue, developing thicker and denser bones, stronger connective tissue, increasing hemoglobin concentration in the blood. So you're better able to deliver oxygen to the working tissues, increasing the strength and size of the heart. So you're able to pump more blood with each heartbeat, increasing the amount of myoglobin in your muscle cells. So you're able to extract more oxygen from the blood. And this is how you get fitter. Your body responds to the stressors in this resistance phase by getting stronger, fitter, faster, improving your cardiorespiratory endurance, improving your muscular endurance, etc. If the exercise is too much, too soon, too often, and you don't have enough time for rest and recovery, you may enter the exhaustion phase. This can look like overtraining, which we'll talk about in a little bit. So the important takeaways from this are: exercise is a stressor on the body. Some is good in appropriate incremental amounts. So if you're new to exercise, you don't literally want to hit the ground running. You likely want to hit the ground walking and then go from there. If you are new to exercise, you want to start at a level that you can do and then gradually build from there. And we'll look at how to do that. It is going to feel sore, sweaty, painful, uncomfortable, like you can't do it at first. It shouldn't hurt in a way that's like, ouch, ouch, I need to go to the doctor, but it should be a little bit uncomfortable. That's normal and appropriate. And your body will start to respond to these stressors over time. You will get fitter, your cardiorespiratory fitness will improve, your musculoskeletal fitness will improve over time if you continue to do it. And the other thing to consider is that you need adequate rest and recovery, and it's not a more is better game. To some extent, more exercise can improve physical and psychological health outcomes. It can reduce the risk of chronic disease. It can improve body composition, but it's not just a more is better game, especially in the absence of adequate rest, recovery, hydration, nutrition. This can lead to what we call overtraining. So to summarize, exercise is a stressor on the body. this is a good thing. It causes what's known as hormetic changes, where some stress on the body incites positive, favorable changes for your overall well-being. So let's look at some specific principles that go along with this. The first one is the overload principle, often sometimes referred to as the principle of progressive overload. So this basically suggests that to see continual improvements, you must continually exceed what your body is used to when it comes to your training. So you must continually progressively overload your training. Now, we talked about this when we're looking at intensity in terms of cardiorespiratory fitness. We're either looking at the duration, how long you're going, the intensity, how fast you're going, or how high, the steepness, the incline. When we're looking at resistance training, we're talking about the load, how heavy you're going, or the time under tension, how long you're holding something or doing something. So the progressive overload principle means that you have to gradually and systematically increase the stress of your training to continue to see improvements in fitness. So you cannot just go to the gym and do the same 3 sets of 10 of the same exercise, the same amount of load, and continue to see improvements. This is sufficient to maintain physical fitness, but it's not sufficient to continually improve physical fitness. And this will taper off over time, as we'll see in a minute, but you do want to be trying to focus on improving one aspect of your load or your progressive overload over time. So you have to constantly be placing new gradual stressors on the body to continue to see change. Training effects. This means that those consistent progressive loads will bring about adaptation, specific changes as a result of your training. So as you add exercise, you will have specific physiological changes to that exercise that will continue to progress over time to an extent. So we have the dose response relationship. Your response is related to the amount of overload or the dose that you do, such that walking for an hour 5 times a week will have a different physiological effect than walking for 10 minutes 5 times a week, or jogging for 30 minutes will have a different physiological effect, greater than walking for 10 minutes, right? So more is more to an extent. Lastly, here we get to diminished returns, which means that while the progressive overload principle is good, it will eventually start to taper off. Your improvements will get smaller and smaller over time as you get closer to your genetic potential. So this means that you're not always going to be able to get, maybe you start doing a walk jog routine, and initially you can walk a mile in 14 minutes, and then you get your mile down to 13, and then 12, and then 8, and then 7. And now you're doing 5Ks and half marathons. You're not going to continue being able to get your mile down to 6 and 5 and 4 and 3, right? There is a genetic potential that will all hit when it comes to strength, when it comes to muscular endurance, when it comes to cardiorespiratory endurance. So the newer you are to exercise, the greater the training effects you'll see initially, and the more those will taper off over time. So let's look at a couple of these. Overload principle in action. So how and when to apply the overload principle. So initially, what you're going to do as an assignment for class, and anytime you want to create an exercise routine, is build out a week-long exercise routine that you will maintain for at least a month or more. And when you're looking at the overload principle in action, you're going to pick one component of your exercise regimen to increase in intensity by about 10% each week. So what does that look like? Let's say you're going to pick the duration, and you start out by walking for 30 minutes 3 times a week. You're going to increase the next week to 33 minutes if you're doing that 10% rule for duration. Let's say and then the next week you'd probably do 36 or 37 minutes, right? So you're going to gradually increase weekly by about 10%. And that's not always going to be definite, and it's not always going to be perfectly linear. So let's say you want to focus on increasing frequency. Maybe you're doing 3 times a week for a month. Then you feel like you're ready to bump up. Maybe you jump up to 4 times a week of whatever activity it is that you're doing. But importantly, you're not going to focus on all of these at once. You're not going to go from week 1 walking 3 days a week for 30 minutes to week 2 jogging 4 days a week for 40 minutes. And while that might sound a little bit silly, this is in fact what many people do when they begin new exercise routines. They jump into some super high intensity HIIT classes. They start doing Tabata. They go to CrossFit. They do Soul Cycle. They go to the gym 5 days a week, body part split for an hour and a half every time. And they crush it for 1 week, 2 weeks, but then something happens. They're sore, they're in pain, they overtrain, they pulled something. It's not fun, right? And so they stop doing it. So then it looks like this: start, stop, start, stop, start, stop, stop. And the most important thing when it comes to exercise is consistency. So what you want to do is start low and slow. Start off where you know you're capable. Pick one thing to gradually progress over time. So either you're going to start going more days per week until you get to your desired frequency, 3, 4, 5, 6, whatever it looks like for you. Again, remembering those physical activity guidelines, exercising most days of the week in some capacity is going to be good for you. And then increasing either intensity, speed, or grade until you get to the level that you want to be at, or duration, length, or amount of time. And this doesn't have to continue to increase forever. You may and likely will get to a level that feels good for you. You've reached a comfortable fitness level. That's great. You don't have to continue increasing these forever. And again, it's not always possible. The double progressive protocol looks at using intensity and duration alternatively. So let's say with resistance training, you're doing 3 sets of 10 to 12 at 50 pounds. We don't know, you're doing a squat here. First, you're going to start out and you can do 10 repetitions of these squats. Once you can get, you're going to then try to keep pushing it to, you can get to 11 repetitions. And then maybe in another week or two, you can get to 12 repetitions for each of your 3 sets. Once you can get to 12, then that's when you're going to bump up in intensity. You're going to add 5 pounds on. Now you're using 55, but you're back down to 10 repetitions. So this might look like with walking or jogging. Let's say you're doing walk run intervals for 30 minutes and you're walking for 2 minutes, jogging for 1, walking for 2 minutes, jogging for 1. First, you're going to increase the duration. So you're going to go up to 35. And then maybe you're going to get comfortable there. And then you're going to go jog for 1 minute, walk for 1. So this double progressive protocol means you're alternatively focusing on increasing duration or volume, increasing intensity, increasing duration, increasing intensity. But again, you're only focusing on one at a time. Pick one variable to increase, and slow and steady wins the race. Unless you have a literal race that you're training for, you're training for life. So just implement these things, find the types of physical activity that you enjoy. And if you're not at the physical fitness level that you'd like to be, use this progressive overload principle in action by focusing on one component, frequency, intensity, or time, duration, and use that 10% rule. So increasing by a couple minutes per week, or increasing by about 10% of the weight or load that you're using, which oftentimes just means either going up to the next size of dumbbells or adding 5 to 10 pounds onto a barbell, if that's what you're using. Principle of specificity, shorthanded as the SAID principle, stands for specific adaptations to imposed demands. What do I mean here, and why do I have this picture of me and my dad on mountain? So the SAID principle suggests that your body will respond specifically to the specific stressors you place upon it. So if you want to improve your cardiorespiratory fitness, you need to do cardiorespiratory training. Specifically, if you want to run a race at sea level, you need to do more jogging, running, walking, whatever combination you can do of running at that altitude. If you want to enter a century bike ride, you need to do more long distance biking. If you want to get bigger, stronger muscles, you need to do resistance training in a specific way. If you want to improve your muscular endurance for a military readiness test, you need to do resistance training in a different way. If you want to develop size in your lower body, in your upper body, you need to specifically target that musculature. So again, it seems straightforward, but your body will respond specifically to the specific stressors placed upon it. So why do I have this picture? What is my story for you? Well, in 2011, back in the day, my dad was turning 60 and decided he wanted to hike Mount Whitney. He'd done maybe 40 years prior. And I said, I'm fit. Sure. I was teaching cycling at the time, probably 7 or 8 classes a week. I thought, got a good cardio base going. I'll hike a big 14,000 footer with you. And so I thought it was going to be a piece of cake. My dad and I did our first training hike at 10,000 feet at Mount San Jacinto near Palm Springs, and I got altitude sickness at 10,000 feet. And all of our training hikes before Mount Whitney, I really struggled. And I would see people with 3, 4, 5 decades on me hiking up at that altitude, rocking on with their hiking poles with no issue. And I thought, what the heck? I'm fit. What's going on here? And this was the principle of specificity in action. While I may have been trained for a specific cardio modality at sea level of particular note, so cycling in place, that may have some correlation for my cardiorespiratory fitness overall, but it didn't translate to the specific modality of hiking, and particularly at incline. So all this is to say is, if you have a specific goal, whether it be a physical fitness, a performance, or a body composition goal, you need to train specifically for it. Last couple ones here, principle of reversibility. This one's not so great. It's use it or lose it. This means that you can't just get to a specific fitness level and keep it forever. You have to maintain your fitness level by continuing to do your physical activity regimen, improve it by continue doing the progressive overload protocol, or you will revert toward previous levels. And this happens about half as quickly as you gained it. So thankfully not as fast, but it will happen. If and when you do start to exercise again, you will regain some strength or capacity at a quicker level than you originally gained it. Principle of individuality. You are unique and your training results will vary based on your own genetics, your genetic potential. So your capacity to put on muscle, your capacity to put on strength, your capacity for speed, agility, cardiorespiratory endurance differs based on your wonderful, unique genetic profile. And so you and I could do the same exact training regimen, and we could even eat the same foods, but we would have two totally different outcomes. And then lastly, the principle of rest and recovery suggests that you need to recover between exercise sessions. So generally for most people, about 24 hours in between training sessions is a good idea for rest and recovery. That means if you trained at 8 a.m. one morning, the next morning is a good idea. Some folks will do more than this if you have a specific performance goal in mind. And then you really need to tailor in your recovery when it comes to nutrition, hydration, and sleep, and maybe other recovery modalities. But for most people, about a day. 24 hours is a good rest time, and then 48 hours between specific muscle groups. So if you're doing some sort of exercise that focuses on your chest and your shoulders and your tricep on Monday evening, you would want to wait again until Wednesday evening before you targeted those areas again for optimal amount of time recovering, and so you could optimally target those tissues and movement patterns again. Otherwise, this may result in excessive fatigue and soreness and something known as overtraining. So what is overtraining? Overtraining, if you link back to that general adaptation syndrome, is getting to that exhaustion phase of the stress response. It's where your body can no longer adequately withstand the stressors being placed upon it. In this case, exercise, but you'll also have to consider the sum total of other stressors here. And it stops being able to meet the demands and actually starts to break down. So we know that exercise is a stress on the body, and that some exercise improves your capacity. It improves your physical capacity, your psychological capacity, your immune health and function. We'll look at all these in a minute, actually. But when you reach overtraining, all of these improvements actually start to drop off and potentially worsen. So while some exercise is good, too much exercise can be bad. Exercise that exceeds your capacity for recovery. And this can result in things like injury or illness, burnout, where you no longer want to train, you become disenfranchised with training, and you no longer keep doing it. So this is that sort of stop, start, stop, start, stop, stop, stop cycle that I mentioned earlier. And the unfortunate thing is there's no set level of exercise that is like, that's it, that's overtraining. It's going to depend on a lot of things. It's going to depend on genetics. It's going to depend on the sum total of stressors going on in someone's life. So if you are working 2 jobs, going to school, taking care of children or elderly parents, have a lot of psycho-emotional stressors, relationship issues, trauma, etc., if you are not eating enough, if you are not sleeping enough, if you are recently sick or injured, you are at a greater risk of overtraining. So whereas at some point in your life, maybe you have minimal stressors, you are going to school, you're not working, you don't have children, you're financially comfortable, you might be able to get a lot more exercise in your day and not need as much recovery. Whereas when you have all of those things that play, you have a greater sum total of stressors on your system. So it's going to vary day by day, month by month, year by year, person by person. But some indicators of overtraining would be getting sick more frequently, so poor immune function, uh, irritability, depression, anxiety, worsened mood, um, tired, kind of chronic fatigue feeling, but difficulty sleeping at night, kind of persistent achiness, fatigue, soreness in the muscles that doesn't really go away in an expected time period, heavy lethargic feeling of the muscles, um, your performance outcomes either plateau or decrease, drop off. So you might get slower, you might get weaker, you might not be able to perform as well in whatever athletic sport or competition you engage in. I already mentioned mental health, weight changes, which can be increases or decreases, changes in appetite. Um, you might see, I mentioned difficulty sleeping. You also will see often an increase in resting heart rate first thing in the morning. So an increase in resting heart rate of about 5 beats per minute first thing in the morning is a great indicator of overtraining. You might also see hormonal changes, skin, hair, nail changes. You might see a cessation of menstrual cycles or an alteration to menstrual cycles in women. So a lot of these physiological and psychological symptoms of overtraining, getting sick more often, injured more easily, that chronic achy feeling, fatigue feeling, but difficulty falling asleep, changes in appetite or weight, irritability, low mood, etc. So all of these are actually quite similar to what just basic chronic stress and burnout look like, but they are specific to an excessive amount of training. And you might be thinking, well, Olympic athletes train like 6 or 7 hours a day. Yes, they do. But they also have excellent sleep routines. They're dialed in with their nutrition. They're eating large volumes and high quality food typically. They also have specific recovery modalities around massage therapists, heat and ice therapy, etc. So they have additional recovery modalities to offset the load, the cost of their training. So if you're noticing any of these things, like I said, not enough exercise or insufficient exercise is a problem for your psychological and physical well-being. Overtraining can also be a problem. So if you're noticing any of these things and you know you train a lot, it may be time to just dial back. Maybe dial back. Again, you can pick one thing on the intensity, the volume or duration, or the frequency of your training. All right. So last for this lecture is, which type of physical activity is best? People love to ask this question when they know you teach exercise science and health. What type of exercise is best? What should I be doing? And the answer is whichever one you will do, whatever cardio modality you like or can do in your body. Walking, running, cycling, swimming, crank cycling, if you're in a wheelchair. My dad is in a wheelchair. He was a PE teacher for his whole life. He had brain cancer and is no longer ambulatory. He gets on a stationary bike once a day and does a rower once a day, right? Whatever kind of movement you can do that you enjoy, if possible, is the kind you should do. All right. And we will leave it there for now.